Let's have a look at our next question. A 50-year-old woman is brought to the ER by ambulance after fainting while having lunch at a local restaurant. Her blood pressure is normal. She reports that the lunch was her first meal of the day and that she began the meal with a strong, very spicy alcoholic beverage consisting of vodka, tomato juice, and spices, a Bloody Mary. Her previous meal was 16 hours prior to lunch. Dysregulation of which of the following nervous subsystems best characterizes the cause of the woman's symptoms? Okay, we have a lady here who passed out while having a meal at a restaurant, and she reports that that was the first meal and she had been having some alcoholic beverages for a while since leading to that meal. Okay, so another question is for us to look at the nervous subsystems and think about which ones would give that type of clinical picture. Now let's think about our blood pressure and blood pressure regulation. Now there are different areas in our body where blood pressure is regulated, different receptors all over that help us regulate blood pressure, different systems that help us keep blood pressure in homeostasis. Now we know the normal blood pressure is usually said to be 120/80. Usually this is really a range, but let's just use that for argument's sake. Now, what happens to your blood pressure throughout the day? Are you conscious of the regulation of your blood pressure to keep it at 120/80? The answer is no, you're not. All the different systems in your body and mechanisms that you have that regulate blood pressure do so autonomously from you, right? Without you even realizing what is happening. So looking at the different nervous subsystems that we've been given here, the only one that can help us in the regulation of blood pressure is the autonomic system. So motor, no, we're looking at motor, that has nothing to do with the blood pressure. Somatosensory, not really the best answer. Special sensory, you could make some argument, but not really the best. Spinal cord, yes, there's some feedback that may go through the spinal cord, but looking at the options that we have, the best correct answer there is autonomic. If you have a dysregulation of the autonomic system, you will get such a picture like we're seeing in this case. Also important to remember is that the alcohol in alcoholic beverages, ethanol, is known to promote vasodilation and decrements in blood pressure, leading to hypotension in dehydrated individuals, which this lady may very well have been.